stage, Dr. Karthik.
Thanks, Michelle. Thanks, Michelle, for the nice words, and thank you, all of you who came early to attend my talk, and welcome all for our first year anniversary of our Chennai Plastic Surgery team. We are happy to introduce 6 new initiatives in our 6 BB Club meet, as well as our first year anniversary meet. The first and foremost is we are adding the dental services along with our cosmetic medicine and cosmetic surgical procedures, and we are launching today the pain-free laser hair reduction technique in our center, and we are launching a new responsive website where you can the website will be open in all the mobile devices in the same way. So we are adding a lot of newer procedures and newer details in the website, and we are introducing a dedicated hair transplant team. Everybody knows the baldness is a major problem in our country, and we are introducing a dedicated hair transplantation team where they only do hair transplant. And we not only concerned about the external appearance, we want to holistically approach the beauty. So we are adding yoga services along with our other procedures. So yoga classes will be conducted in our center every day, almost 4 classes a day. And along with that, we are opening most of the time the problem comes when they come for the non-surgical procedures. Most of the actresses, most of the other moving population, they come for 1 sitting, other 2 sittings they can't do it in Chennai. They want to go to, because they may be moving to Hyderabad or Mumbai. So we are opening multiple branches all over India. Now at present we are opening in Mumbai, Hyderabad, Bangalore and Tirupati. So all are new introductions today, and probably before that I want to give, as usual, a boring lecture about what we do, and I don't want to prolong the talk, and I'll make it very short and sweet. As a surgeon, I'll start with the surgical procedure, then slowly move on to the non-surgical procedures. And before moving to the surgical procedures, every time when I train my staff, and as well as when I'm taking a new staff, one thing only I look at them. So how they treat my client. You know, like training and doing other technical work is different, but how they treat my client, that's very important to me. What we want from our Chennai Plastic Surgery, we want a happy client in end of the procedure. In consultation, we educate the clients about the procedures available for the particular problem. And our aim is to explain about the pros and cons of the procedure, make them understand and be truthful to the client. And during the procedure, and complete comfort is given to the client, we concentrate on the comfort and satisfaction during the procedure as well. Our anesthetist will take care of the pain during the surgery and after the surgery. Most of my clients know about it. And thanks to Dr. Tennis and his wonderful team, where they are giving a painless recovery possible. Our aim is to make the client happy during the surgical and non-surgical procedure. And post-procedure, though we explain everything initially, we provide a post-procedure care pamphlet to completely give an idea of what they have to follow after surgery. So, same way, most of the time the problem happens between the doctor or any kind of a customer service, the communication gap. We want to reduce the communication gap as less as possible, so all our staffs are approachable in most of the time, and we are approachable in all the technologically advanced way like WhatsApp, Facebook, Gmail, Skype call, or LinkedIn, Twitter, and every way you can approach us. So we don't want to we want to make sure that we are reducing the communication gap. And not only that, every week we have a meeting where we discuss the before procedure photograph and after procedure photograph, and we, along with all the staffs and all the doctors, we discuss how to improvise the results. We slowly, not just doing the procedure is not adequate, you have to review your results. Then only you can improvise yourself. So we regularly do it to give very good results to our clients. So as I said earlier, happy clients and end of our procedure. And to start with, as a surgeon, as I said, I'll start with The commonest procedure in surgery, what we do is the biggest social problem. It's a male breast formation and how we correct it. See, every time I spoke about the advantages of going through the cosmetic procedures, this time I want to make the crowd understand it's not a simple thing to undergo procedure. They need to know the complications of the procedure as well. So this male breast problem is it disturbs the client like anything. So I remember engineering college student who attempted suicide thrice. The family does not know why he attempted suicide. They realized that that's because of the male breast problem, because he can't reveal it to the parents. He feel ashamed. So finally they brought him here. So we corrected it. So what I'm trying to say is it's so much it affects their it is the biggest social problem, and they don't even remove the shirt in front of the parents. We always roam with a banian only, and he never goes and participate in any kind of a sports activities. Though we think it's a simple problem, it psychologically affects the patient like anything. And what are the complications? See this patient. See the posture of this patient himself. He's drooping. He's kind of bending, hunching his back, and same. If you see the after surgery results, his posture itself changed, and it gives a confidence in him. So that much amount of confidence it gives to the client after the surgery. And normally, earlier days, it's the biggest procedure. The patient get admitted in the hospital for 3 days, and after 3 days, during the 3 days hospitalization, they keep a draining tube, and it's a kind of a disturbing thing for the client, and they can't go to the work for at least 7 to 10 days. And now it's a completely a day care procedure. We don't make any extra cuts. We make a cut in the armpit region so nobody can see it. Even the cut size is only 5 millimeter. Obviously, it is like the scar is almost invisible. So sometimes people will end up in a problem like loose skin. See, if you consider what is the previous one? See, for this person also, like initially we thought he may be ending up in loose skin formation, but most of the people after the surgery, the loose skin settle well. If it's not settling after 6 months, we want to correct it. So go to the next one. Yeah. So why we are not correcting it in the first time itself? When we feel it's going to be a problem, if you do the correction, you have to end up in a scar like that. So the whole purpose of doing the procedure is we don't want a scar. He wants to remove the shirt in front of others. So if he give a big scar like that, no point in doing the surgery. So we always wait for 6 months. If we wait for 6 months, if skin is not redraping, then they're ending up in a circumferential scar where it's not much visible. So always we educate the patient and we make them understand loose skin may be a problem when we remove a lot of fat and glands. So we assess him after 6 months. If he has a loose skin problem, we correct it by simple circumferential excision. And sometimes we make it a asymmetry, and 99.9% of the time after the removal, there won't be any recurrence of this problem. Knows me, wherever I go, I talk about liposuction, so everybody knows me about liposuction and body contouring surgeon. So, see, most of the people when they come to a consultation, they think that they can come like this and go out like this. Obviously, no. See, the problem in liposuction is it only reduces the fat in the area where they are doing liposuction. But overall, the appearance will only change when they diet and exercise. It's not a shortcut for dieting and exercise. Then who will undergo liposuction? Liposuction is done for the people who work out, diet, they are reducing fat everywhere, but they are not reducing in a particular area of the body, even in spite of the repeated exercise and diet. Only those people will benefit by liposuction. So that is called resistant fat. The resistant fat only will benefit by liposuction. There also the problems are, see, we did a liposuction for the tummy. The tummy is fine. When she came back after 8 months, she is not happy because she gained 5-6 kgs. She thought that it's a shortcut for any weight and any dieting and exercise. So she gains 5 to 6 kgs after the liposuction. She put on weight in the thighs. The major problem of liposuction is the fat distribution pattern changes. So because when we remove a fat in a particular area, we are reducing the number of fat cells in that area. When we are so when they eat and put on weight, automatically they gain weight in the area where we are operated. So people who think that I can't maintain my weight after the liposuction, better not to go for the liposuction at all. So if they are really dedicated working out, better to go for liposuction. One more client, one more patient whom I do liposuction is, they come with a male breast problem. Same time they want to combine tummy or back, I do it. Because anyway they are undergoing a procedure, we can combine both the areas. Same time I'll make them lose weight by our regular weight loss program, and I'll make them lose at least 10 to 15 kgs along with the liposuction procedures. So one of the other common problem, but everybody think that there is not much solution for this, is the multiple fat ball problem. Its incidence is 1 in 1000. So a lot of people, they have multiple fat balls like that. It's called multiple lipoma, and they don't wear a full half sleeve at all. They feel that they always come with a full sleeve shirt, and they even feel that it is going to become cancer or what, and they always search in the internet whether any new procedures have come in the recent times. So the problem about the treatment of this is completely benign. That means it never becomes malignant. It never becomes cancer. The only problem is only cosmetically disfiguring thing. So what normally other surgeons do, they make a multiple cut. See, if example this hand has a 40 lipomas, we need to make a 40 cut to remove the 40 lipomas. So end of the procedure, they'll have a 40 scars all over. So we, in our center, we developed a novel technique where we make a few small folds, and through that we completely remove it. Next slide. This is one of my patients. Like, we first do a liposuction, we reduce the size of the swelling, finally we make a small nick and squeeze it out and remove the lipomas. This is like nowadays we are getting enquiries all over the world. Yesterday we operated from a client from Nepal. Last month we operated a client from Canada. So nowhere else they are doing this procedure. They are coming all the way from different countries to get operated by me because of this problem. See, everybody are we say plastic surgeon. They think only of correcting the nose, because a lot of actresses, a lot of actors, they undergo this nose correction surgery. So they think that it's a simple procedure. Actually, one of the very difficult procedure in all the cosmetic surgery is nose correction. Because you need to have very good aesthetic sense, and we need to predict the results. What is the final result after 6 months, and we need to know the exact procedure what we are going to do. So for this, my mentor is Dr. Satish Vyas. He's a practicing plastic surgeon from Detroit in USA, and we are fortunate enough to get a lot of chances to get operated together in our own Chennai Plastic Surgical Center. Since he can't come for this anniversary, he sent a message from his home.
I'm so happy to know that Dr. Karthik is celebrating the first anniversary of Chennai Plastic Surgery this Sunday, and I have had the privilege of knowing Dr. Karthik for the last few years and working with him and working for Chennai Plastic Surgery. I wish him the best of luck. He's a wonderful young man, fantastic surgeon, and I wish everything best for him. Thank you.
So recent time, last week he came and he operated in our center, and it's a difficult rhinoplasty surgery, and he's a wonderful surgeon. Why he is different from other people? He's sculptor by himself, and he is a very good painter, and he has a wonderful aesthetic sense. He has done thousands of sculpture like this, and it is his grandson, and he sculpted his wife and his daughter, and he painted thousands and thousands of pictures like this. He is a wonderful artist too. He do part-time. His plastic surgery is a part-time work. The full-time work is all those things only. A very complex technique. Yeah. Talking about all the surgical aspects, this is the commonest procedure I just want to mention here. Now we are going to most interesting things for everybody. everybody wants to improve the skin color. Even the brightest girl wants to improve the skin color by 2. Even one of the girl here, she's asking what do for the skin brightening. Then I understand. See, now the skin brightening we achieved, like last 1 year, if you take the skin brightening aspect, a lot of newer products got introduced in the market, and a lot of newer way of approaching the skin pigmentation problem. See, most of the Indian skin type, we have excess of melanocytes. These melanocytes behaviors are well studied now, and we have a lot of research in the melanocyte arena. And now we have a lot of cocktail products where the cocktail products, not cocktail products to cure the total flaws in the skin. So even through these cocktail products, we can even increase the skin tone by 2 to 3 better skin tone and with a very good skin glow. Only thing is, all those procedures have a little downtime, 4 to 6 weeks of skin peeling. If they tolerate that aspect, we can completely transform the skin into different skin. And other commonest problem, what we are coming up after this for both male and female, the hair fall. The hair fall. Normally we use minoxidil and finasteride for the hair fall management, but it's slowly going out of the prescription pads because of the known side effects. So we are coming last few years, we are coming up with a lot of caffeine-based shampoos and topically acting finasteride and a lot of peptides are used in the hair fall management. And this is prescription for the hair fall, but now we have a semi-invasive procedure where we increases the hair growth as well as we increases we rejuvenate the face using the product called PRP. PRP is nothing but a platelet-rich plasma. It is taken from your own blood. The stem cell is a magic word. If you tell stem cells to anybody, they get convinced for the procedure. But that's the reality. The stem cells are not allowed to officially use it in any cosmetic procedures. The original stem cells are not, now till today, the stem cells company people are here from Harvard, they agree with me, but stem cells are officially not allowed to use it in any cosmetic procedures. It's only in research sites. So don't believe if somebody tells that we are going to inject stem cells for you, it's a plant stem cells, a lot of other stem cells. So lot of bogus people, lot of quacks are using the stem cells, saying it's going to work. But what is the PRP? The PRP has the platelet plasma taken from your own blood. It has more stem cells in the, see example 10 ml, if you 20 ml if you take, you get 3 ml product. The 3 ml has a lot of stem cell concentration. That's not stem cell per se. So this PRP is used as an injection form in treating the facial to increasing the youthful look in the face as well as to increasing the hair growth. It is one of the most promising recent time showing for the hair growth. It's only an injection over the scalp, but the problem is it's so much painful. We have to do it under mild anesthesia because initially when I finished the training in US and came back for using the PRP, we used it in the side room. Patient is wincing with pain. Then we stopped using it in the side room. We take them to the theater, give a mild anesthesia, and they recover in half an hour time. They go back in 1 or 2 hours time. But it's a mild anesthesia procedure to give comfort to the client. Other one now, see, 6 months back we introduced a machine called Exilis, where most of our clients are very happy about the machine because when I say liposuction, everybody gets, it's a surgery. No, I don't want any surgical procedure. I want a non-surgical procedure. As a surgeon, I don't believe in the non-surgical procedures earlier days, but when I buy the machine and I saw the results of the machine, I'm extremely convinced that it's really effective one. Not only reducing the fat, it tightens the skin too. There's a small video about the Exilis. It's a simple machine. They apply gel and oil over the body parts. And they keep moving the machine. It has 2 energy in it. One is radio frequency, another is ultrasound. The ultrasound.
So if you're not in this part of the industry now, you're really missing an opportunity to get in on what's the highest.
It reduces the double chin. It gives a very good appearance to the jewels fat. Basically, the ultrasound will burn the fat by making the fat cell membrane leaky, and the radio frequency will increases the collagen content as well as it repairs the already damaged collagen fibers.
To get it every time.
See, till today, none of my clients came and said it's not working or I'm not happy. Whoever is not happy because of the expectation, they are not achieved their expectation. They definitely agree that there are a lot of improvements, but this is not my expectation. But all are happy about the procedure.
This machine with two heads does both skin tightening and body
And
forming.
today the ladies and they come and ask me, did you do hair removal? I said, well, no. But I'm more worried about the pain about the hair removal process. So the major problem in laser hair removal is the pain. Thanks to the Alma Laser Company, they introduced a machine, the pain-free machine, and a lot of clients who were underwent the procedure in other cities, they came and told me it's a very good machine and they're very happy about the results. After that, I did a lot of research before buying the machine. In online, a lot of good reviews about the machine, and we bought the machine. It's on our center. It's a wonderful machine, I suppose.
They no longer had to shave, pluck, or wax unwanted hair, but worry about the pain associated with more permanent alternatives, such as electrolysis or laser hair removal. Well, now, there is a faster, more comfortable approach to silky smooth, beautifully bare skin. It's called Pain-Free, Hair-Free Laser Hair Removal Treatment from Alma Lasers, and it is being described as one of the most comfortable hair removal options available today. Pain-Free Hair-Free was designed with a unique technology that offers virtually painless, safe, and effective treatments, and has quickly become the preferred choice for permanent hair reduction. Here's how Pain-Free Hair-Free technology works. Pain-Free Hair-Free incorporates cutting-edge medical laser technology with the experience of a soothing day at the spa. The system's unique in-motion technology, along with the sweeping motion of the laser, safely and gently heats the hair follicles under your skin while you stay comfortable. In addition, a
Like
chilled
when we
applicator
introduce the machine, a lot of people ask me what is how many times I need to come and how many sittings I need to do. Normally, advice is 4 to 6 weeks gap. They have to go at least 6 sittings, 6 to 8 sittings. Then see, everybody advise it's a pain-free and hair-free machine, and it's not completely hair-free. What you have to expect is only 80 to 90% reduction, not the full reduction. So basically, the left behind hairs are the villous hair, very fine hairs. It can be visible to the naked eye. So it's not a complete hair. Whatever procedure you're going for the laser hair removal, it's not a complete removal. It's only 80 to 90% removal. Okay.
Is your answer. A worldwide revolution is underway.
The hair transplant, like it's a big market, so most of the multinational companies and most of the people just finishing the MBBS, they'll come and start doing the procedures. They'll open 7-8 branches at a time. When they're entering into the business itself, they open 7-8 branches, and they make paramedical staff sit here and saying that he's a doctor, and the basic aim is to convince the client for procedure. That's the only aim. So they open in a big way, and lot of multiple centers open all over India. But a lot of debate happened, a lot of false promises in the advertisements, and so when even last week we are meeting with the hair transplant surgeons meeting, and we discussed how to stop all the quacks practicing this hair transplant, because even one death occurred during hair transplant when an untrained person done the hair transplant and patient went in for sepsis, lot of infection. The patient was airlifted from Calcutta to here for managing, and in Apollo they treated, and he died finally. So better to select a person and the place. Select a place that they're doing in the theater. Don't select a place where they're doing in a side rooms, a very unhygienic way. So what is new in the hair transplant recent times? Like everybody worried about the scar what they are going to get in the hair transplant. We take a strip of skin from here and we take each hair separately and we implant it in the front. But once the hair grows a little, it completely disappears. So only when they tonsure the head, the scar will be visible. So a lot of companies use this this scar as advantage. They advertise as a painless and scar-free technique. But the scar-free technique that is restricted for the smaller areas. You can't go and ask for example, you need more than 1,500 grafts. You're completely bald. Better not to go for the scar-free technique. Then the scar technique is a better way because we get more grafts. So in this way, we can go even 3,500 to 4,000 grafts in a sitting. But when you are taking the carless way, what we will do is, we take each punch separately and each hair we take it separately. So they have only multiple puncture wounds everywhere, so it heals in a day or two, but it is not suitable for the major transplants. Only it's suitable for the transplant which for less than 1,500 grafts. So I am probably suitable for the so this is the place where we are planning, we are doing the surgeries. This is a wash area. After that, patient will be shifted to the theatre. We will do the hair transplants here, and this is a few of our results. I don't want to bore you with all these things. Finally, I want to announce we are planning to launch multiple centers and all over India. Dr. Deepika Shetty will be in charge for the Mumbai center, Dr. Deepika Shetty and Dr. Manoj, and Dr. Pavitra will be in charge for she is a well-known orthodontist from Jubilee Hills area. She will be in charge for Hyderabad center, and Dr. Kiran will be in charge for Bangalore center, and Dr. Gautam Reddy in charge for the Tirupati center. Thanks all of you to come and attend this anniversary function. We hope to serve much better with multiple centers all over India now. Probably we will maybe moving to other countries very soon. Thank you very much for the patient listening. I hand over the mic to Michelle.
Karthik, once again, can we please hear a huge round of applause for him? Hair is an essential factor when it comes to defining good looks. It is a reflection of your internal health, especially for women, for whom it represents femininity and attractiveness. Men associate hair with youth and vigor. Hair transplantation is a surgical process that works for a lifetime. Regardless of where they are located, when done right, you can be so natural that even your hairstylist will not know that you've had it done. But the skill and techniques of hair transplant surgeons does vary widely, as do the results. It's important to choose the right procedure and clinic to assure that you will get completely natural results. Chennai Plastic Surgery has brought together the best of doctors from various fields to form a hair transplant team, and I would now like to introduce them to you. Firstly, I would like to invite on stage Dr. Karthik himself. I would like to introduce to you a highly experienced, soft-spoken and dedicated doctor who with over 14 years of experience specializes in plastic, reconstructive and burn surgery. He works efficiently with the qualified experts on the Chennai Plastic Surgery team. Please welcome on stage Dr. Venkatakiran. The next doctor I would like to introduce is a professional trichologist with her unique expertise and experience in diagnosis and counseling. She has treated national and international patients suffering from scalp and hair diseases. Please welcome on stage Dr. Khaled Salim.
Khaled is not here. Sorry for the thing, but she will be joining with us very shortly.
Definitely. Thank you, Dr. Karthik. Next, I would like to invite on stage a chief plastic surgery consultant. He is an expert in aesthetic surgery, hair transplantation, reconstructive surgery, orthoplastic surgery, burns and hand surgery. He's been practicing hair transplantation in Mumbai, and now he's about to join us with Chennai Plastic Surgery. Please welcome on stage Dr. Manoj. And now I'd like to introduce to you a dermacosmetologist with a strong passion for beauty and skin. She is a consulting expert in her field. She has traveled globally, interacted with diplomats, and has had the privilege to consult even Dr. Abdul Kalam himself. Well, she's not here with us, but this wonderful doctor is Dr. Deepika Shetty. And finally, I would also like to speak about a doctor who is as well not with us today. Dr. Pavitra, who is a famous orthodontist from Hyderabad, and she's going to be taking Chennai plastic surgery to her city. Can we please hear a huge round of applause for our head transplant team?
Probably Manoj can speak to you about hair transplantation in Mumbai, how it is happening now, and we are planning to set up the centers all over India, so he's going to head the hair transplant team in Mumbai. He's my dear friend, and we trained together in Apollo Hospital, Chennai, and few words about the hair transplant in Mumbai.
Thank you, Karthik. And I'm very thankful to Karthik to introduce me in such a very good way. Hair transplant, as we all know, he has already introduced what is that. And in Mumbai, we have a long way to go because there are many cracks there. And I know this team will also have very genuine kind of a hair transplant unit all over the world, not only India, and we are heading up to that. I again thank all the team as well as Karthik for this wonderful opportunity. Thank you.
Thanks, Manoj. Kiran is a shy person. He does not want to talk much in the stage. Anyway, he's going to talk about the hair transplant in Bangalore.
Hello. Hair transplant is the commonest procedure it has become. In that, FUE is the commonest procedure. Now patients are well known through the net and through the media. They know about FUE. It's an upcoming procedure, and we are very well trained with that. And I hope this team expands to the international standards.
We will. And Dr. Deepika Shetty, his flight is early, so he left early. She left early, and Dr. Talati is a practicing trichologist for the last 15 years in Chennai, and she has a wonderful experience in managing the hair fall and other medically how to correct the hair fall problems. And she's joining with us in the hair transplant team. I think we can do a very good work. I want to show the sisters also, because it's a teamwork. Not only surgeons are important in this work, the dedicated sister team is that staff nurses are very important. All Nirmala Devi, Kandimadi and Rajshri, have more than 6 to 8 years experience in the hair transplantation unit, and they are with us for the last 1 year, and they are going to help us in all our procedures. We are going to start the hair transplantation training center soon in our center. Thank you.
Can we once again hear a huge round of applause for Chennai Plastic Surgery's hair transplant team? Ladies and gentlemen, as you know, Chennai Plastic Surgery offers you both surgical and non-surgical options that enhance your looks and enrich your beauty. We believe in wellness altogether, which is why we have begun a new venture of yoga, reflexology and alternative therapies at our center. Now, to tell us more about this initiative, I would like to invite Mr. Subramanian from S. Vyasa Yoga, University, Bangalore. Can we please hear a huge round of applause for Mr. Subramanian?
Thank you, namaste, all of you at Chennai. And just like the Trivedi Sangama which is there in Prayag, Vrinda, Yamuna and Saraswati, three wonderful institutions are joining hands to make this yoga venture possible in Chennai Plastic Surgery. I would like to say the Ganga being Chennai Plastic Surgery and Yamuna Yoga Institute by Mr. Ashok Kumar, and the underlying River Saraswati is S. Vyasa Yoga University from Bangalore, and we have all joined hands to make this thing possible. Rightly said by her, and of course by Dr. Karthika as well. Today people are not only looking for how they would look outside, but how they would look inside. There's a world within, and that is also very, very important. In fact, to learn yoga in our yoga university, people come from all walks of life, and I see nowadays a lot of beauticians, beauty doctors also coming to learn. And I ask them, why do you want to learn this? They say, we realize the importance of the inner beauty, and therefore we want to give that also to our clients, to our patients, and therefore that has become very much necessity today. And therefore yoga, not only that it has the external things like you have wonderful cure through the yoga therapy, for the physical body, but also the subtle body also can be taken care. The mind is very important. Today people are stressed a lot, and then yoga does a lot to calm down the stressed mind. And that is where yoga can do a lot. And we, the Bangalore S. Vyasa Yoga University, Swami Vivekananda Yoga Anusandhana Samsthana stands for Yoga Research, led by great medical experts, Dr. Nagatna, who is MBBS, MD, FRCP, and she is the head of the medical team there, and Dr. Nagendra, who is a NASA scientist and alumni of IISc, Minister of Science, Bangalore, and also great people, great academicians, scientists, they are leading this. Today, yoga has become so popular that, and I am not talking about anything about yoga, people know more than what we can say, because any channel you go, morning channel sessions begin with a yoga session. Any magazine you go, you can learn about yoga from that. In fact, I would say, earlier we used to say Mata Pita Google Devam, Guru Devam. It has become Mata Pita Guru Devam. Google Devam, wherein you go to Google and then just type the word yoga, you have 1,008 types of yoga. In fact, when the yoga teacher faces problem when we say I'm teaching yoga, which yoga you teach? Because there are more than 1,000 varieties of yoga, starting from Iyengar yoga, Bikram yoga, Krishnamacharya yoga, to Shilpa Shetty yoga. And therefore, which yoga you teach has become the big question mark today. And here we stand for the traditional aspect of yoga, which the scriptures are given. At the same time, how they can be relevant to the modern world. That is very important. Yes, fine, yogas are lying in the ashrams where gurus teach, but we are not able to relate it to the modern lifestyle, modern way of conditions where we live. And therefore, we take the traditional system of yoga, authenticated by modern scientific research, clinical randomized control trials. We have more than 300 research papers published in international peer-reviewed international index journals, published by medical experts. We have collaboration with all kinds of medical institutions, starting from All India Institute of Medical Sciences, AIMS, NIMANS, National Institute of Mental Health and Neurosciences in Bangalore, and MD Anderson Cancer Center in Texas, USA, and KWA Hospital in Munich, Germany, and various leading medical experts have joined us to collaborate in this yoga research. And in this journey of yoga research, especially the clinical side, with beauty faith also, we are very happy to collaborate with Dr. Karthik Ram and his wonderful team, along with Shri Ashok Kumar of Yoga, and extend this to this wonderful area also. And yoga has a lot to contribute there, and we have enough authentic research data to substantiate that. And with this background, we will be able to do wonderfully. May you all join hands with us in introducing yoga to bring out the inner beauty that is joined together to bring this. And we have here with us our dedicated yoga teachers who have been very well trained, Madeline and Prem Kumar. Represent to best. They will be associated with, on our behalf, with Dr. Karthik's clinic, and then they will be teaching you yoga. And after this session, maybe those of you who are interested in joining the yoga session can meet them, get to know the details of the session. Thank you.
Once again, a huge round of applause for him, please. Moving on with this evening, we would like to present to you our new website. We have added new features to it, making it more informative, responsive, and the best part is, it can be accessed easily and perfectly visible on your phone. So ladies and gentlemen, presenting to you our new responsive website. Well, all of us want a perfect smile, don't we? Yes? Yes. Well, while few people have one naturally, almost anyone can get one with the help of a dentist. From subtle changes to major repairs, your dentist can perform a variety of procedures to improve your smile. A number of people are opting for cosmetic dentistry these days, as this provides you with an easy way to get the perfect smile. smile and help you to be more confident. This being said, I would like to introduce to you our Smile Doctors, our dental team. Firstly, I would like to invite on stage an acclaimed smile designer. His name many Indians recognize, for he has worked on their smiles using painless laser technology. Qualified from Germany, Austria, he promises his treatment involves no injection. I think that's good news for needle phobics like me. No bleeding, and the best of all, no pain. His involvement on the panel makes it a one-stop shop for all areas of modern beauty enhancement methods. Please welcome on stage Dr. Dina Dayalan.
Good evening, ladies and gentlemen. This is Dr. Dina Dayalan. By the way, your appointment tomorrow is between 10 to 11. Right, with this, I think I'll take up, as she said, this is Dr. Dina Dayalan, studied from different part of the world, but a true Indian, a Tamilian, Vanakkam Chennai. So to carry on with my presentation, I'm not going to bore you guys with a lot of slides, just going to be 4 or 5 slides. I'll finish it up. Mainly we deal majorly with implantology, crown and bridge works, the laser, as she said, painless one, and orthodontic surgeries. Implantology, for those who miss a lot of teeth in their mouth or maybe a single one, but it should never be seen by others, we make it very, very special. Metallurgy, you name it, it's Italy or German. I have been totally trained under the Germans who make the best metallurgy out of it. So these implants, they carry their own weight, such that it's going to produce a wonderful aesthetics for you all. Guys and girls, these are going to be a wonderful one, the edge cutting technology which we use it, which is combined with the laser. So you have any crown, if you don't mind, this is the point, right? Yeah. This is going to be a broken tooth or something like that. Immediately she wants a crown to be replaced, but the strength of the tooth is not going to be there. We put an implant, we build a zirconium abutment, and this is what the results we produce it. This will be done within 3 days. The temporary will be given. The permanent will be done another 3 months and will be given to them. So you put an implant, you go back to your place, you can come back after 3 months, you can get your permanent fixed like that. So going back to another one, implant smile, not just the rich peoples alone can go for an implant or so. It's very common nowadays. Any Tom, Dick and Harry whoever runs in and around Chennai or any part of the world, they can get it done. A vegetable vendor from Tambaram, he came without any tooth here. About 8 to 9 implants has been placed, and that's the smile. She got it within a day. Ladies and gentlemen, it's not just for the rich alone. We have come down for everyone. Any Tom, Dick and Harry can get this. This is what our ultimate aim is, to bring it up. So we go for another specialization. Always they want everyone on a bright smile. No? So the laser is another one more tool which is going to get a very pleasing one with some gingival pigmentations, which you can able to see it from the gingiva. Bleach as well as a gingival depigmentation has been removed. You can see the canine is slightly outwardly projected, the same one. Now, graphics has been added into it. Laser is a fine technology which we are using it. Karthik has it for the external one. I use it for the internal as well as for the dental smile. We have something called as a diode and the RBM mark. RBM mark is supposed to be the edge cutting technology, which they use it right and left to reduce the pain and to bring the best results out of it. The next one, you can able to see some small papilla. This is just to prove that the pigmentations which you are seeing it will vanish like that. With the help of Karthik only, which has been done, and you could able to see this. There is no pigmentation out. After the smile, there is no depression or ditching or anything in the nose. This is just to show you how it is getting done in the external skin too. So then you can imagine how the gingival depigmentations which you have it. Always the white tend to, reflect the light. The black tend to observe the light. So with the laser, probably all the pigmentation whichever is there will get vanished. So make use of it. And the other branch of it is your orthodontic surgery. Justin, my famous patient always, I always put this slide. Why? Because it's not that, I like this guy person, I'm not that, This guy came to me when he was in his first year of his college. He refused to go to his college. He doesn't want to do any work, nothing. He just want to do. No, he was not coming out of his room. Bit psychic he was. So slowly he came. We somehow managed him to treat it with orthodontic brackets, which you could able to see it. After a year, we just went for the surgery. Now with the long hair, you could able to see he's running like a Remo. Has 2 girlfriends, he used to tell me. That's a secret one. I guess my wife is not here. So that's his profile. You could able to see it. Another one more. We call this Michael Shoemaker's profile. A fantastic guy, Varun. Planned for a long time. Collected all his pocket money, not spending to any of his girlfriends. He collected and he came. And believe me, that is also not a very costly one. This was his profile, and this is his frontal one. Now you could able to see he runs a very straight profile. Now his haircut has, I don't know, this is some crew cut or something like that. And believe me, he also has 2 girlfriends. I'll get you the phone number later. And another one more woman who runs a milk shop or something like that. She wants all full mouth rehabilitation to be done. Only 2 teeth has been left out there, and about 3 to 4, that too it's fully damaged. Multiple implants has been given with a hybrid denture. This also has done within a week, and it's been handed over to them. That's a perfect smile. We render it to you all. Ladies and gentlemen, make use of it, and zirconium is the crown which we use it right and left. Any questions you can shoot. Thank you.
Training in dental laser and implantology and qualified at the Dr. MGR University. I would like to hear a huge round of applause for Dr. Hamsa Priya.
I'm sorry, I should have introduced my colleague, Dr. Hamsa Priya. It's a great thanks for her. I'm honored that she helps me always right, left. She's my right hand, left hand, my kidney, whatever you name it. So without her help, I could not run my show actually. She is the best actually. Thank you. Sorry, Hamsa Priya, I missed you. Sorry.
Thank you. Thank you. Chennai Plastic Surgery is associated with Naturals to open a mini spa at Khadir Navaskan Road. And to tell us more about this, I would like to invite Mr. C.K. Kumaraway.
Hi, good evening friends. Dr. Karthik, the team of Chennai Plastic Surgery, friends and well-wishers of Dr. Karthik. It's been a great pleasure to associate with the team. In fact, I have never met a doctor who is so good in marketing and PR. I have met so many doctors so long, but Dr. Karthik is a very rare exception, and I think he handles PR and the surgery very well. Congratulations to you. In fact, we were thinking of doing something special for our 300th salon launch, and that's happening in the Khadir Navaskan Road. That's where we were looking for idea. And we bounced off the thought to Dr. Karthik to do a medispa. So we have done so many salons, and the one more natural salon is again a routine concept. So we thought we should do something different. We checked up with Karthik and he readily obliged. In fact, we have gone so forward, we are a little lagging behind. We will put it together. We are trying to open it in September. This will have the hair transplantation, the skin whitening, the obology treatments, and so many things what Karthik has been talking about, which we were shying off, because all this requires a doctor to handle on the spot. So that's when we thought we should keep it away and refer the people to Chennai Plastic Surgery. Now that we thought it's a time to align formally and do this project and see how it works. If it works out well, we can do a lot of franchising. That's what we are known for. We can take it up to more number of places. I advance birthday wishes to Dr. Karthik, and thank you so much.
Must end well, and I would like to invite Dr. Hamsa Priya for the customary vote of thanks. response. On behalf of Chennai Plastic Surgery, I'm grateful to you all for coming to share this night. For a large measure, this occasion honors you, for without your help, loyalty and friendship with us. We take this opportunity to thank Karen Cute and Abbott Private Limited for their support. And also at this point, I wanted to thank the Chennai Plastic Surgery staff for their team effort, and Ram, who has done his photo work and video works for us, and Ms. Amita, who has done a back job for us in her content work, and all the doctors from various parts for sparing their valuable time for spending with us. And once again, I thank all the guests for their patience and presence with us. Thank you.